The Lagos state government has urged members of the public to disregard a list making the round on social media of hospitals and health facilities purportedly exposed to COVID-19 cases in the state. The Executive Secretary, Lagos Health Facility and Accreditation Agency, HEFAMAA, who disowned the list which was purported to have emanated from the Ministry of Health, disclosed that the Ministry of Health through HEFAMAA never issued any statement advising the public not to patronize certain facilities in the state. This is the handiwork of mischief makers and fake news merchants who are bent on causing panic in the community and eroding the success recorded in the battle against COVID-19. I therefore urge residents to disregard the list in its entirety and rely solely on the Ministry of Health and HEFAMAA for information on the operation of health facilities and management of COVID-19 cases, especially at this critical time, she said. Read also, Nigeria reports 108 new COVID-19 cases, total infections now 981. Idaho explained that some health facilities might inadvertently admit or treat patients with COVID-19 without knowing. She stated that if this happens, the facility will be temporarily closed for decontamination while the staff would be trained on infection, prevention and control, after which the facility is safe to carry on its normal operations. She appealed to members of the public to desist from stigmatizing health facilities that might have been exposed to COVID-19 cases as well as patients infected with COVID-19 to prevent severe health problems. We need people to desist from stigmatizing such facilities. They are only closed for decontamination, and once that has been done as well as other necessary protocols, the facility is safe to offer services to the public, the executive secretary stated. Idaho also observed that stigma can drive people to hide the illness to avoid discrimination, prevent people from seeking health care immediately, and discourage them from adopting healthy behaviors. She urged all health facilities operating in Lagos to adhere strictly to the principle on infection prevention and control, maintain high degree of suspicion for COVID-19 and adhere strictly to laid down protocols for COVID-19 suspicion. She added that IPC will help reduce human-to-human transmission and secondary infections among close contacts and healthcare workers. She advised facilities against unauthorized admission and treatment of confirmed COVID-19 cases, warning that any facilities caught violating the laid-down protocol of operations, especially with regard to COVID-19 case management, will be sanctioned in line with the extant provision of the law. She reiterated that only facilities approved by the state government for COVID-19 case management are expected to carry out the management of COVID-19 cases. Idaho urged individuals in the state to desist from issuing panicky statements to the public on operation of health facilities. This, according to her, is capable of causing confusion and making the fight against the pandemic more challenging.